Good morning, Mrs. Skoko. My name's Jennifer. I'm going to be your nurse today. How are you feeling?
You can call me April. I felt better, and this is Odette. To be honest, I'm having a lot of pain in my breast, and I just wanted to come in to make sure everything was okay.
So you've been having a lot of pain in your breast. I'm just going to elaborate on that. First off, can you describe the kind of pain you're having and when all this pain started?
Sure. So I woke up yesterday around 8 a.m. and there was just a lot of pain in my breast. It's hard to describe. It was just overwhelming. It was swollen. I had a huge headache. I had muscle aches, felt nauseous, and overall just blah and not myself.
Yeah, I'm sorry to hear that. Is the pain present in both breasts or primarily just one of them?
Primarily just my right breast.
Okay, and if you had to describe where the pain was located, would you say it's at the upper region, the lower, or all over?
Upper region, but it's a lot of pain, so I'm not too sure.
Yeah, for sure. I'm going to have to do a physical assessment if that's okay with you.
Yeah.
Awesome. So before we get started, I'm just going to have you take your gown off, but I'm just going to take Odette because she's sleeping. I'm just going to put her in her stroller, okay?
Okay.
Just while you take your gown off. Okay, so I'm just going to hand sanitize, put some gloves on. So I'm just going to touch your breast and compare them both, okay?
Okay.
Okay, so it's your right breast, and you can easily see that just from looking at it. You can see it's swollen, it's red, you can feel the heat. So I'm just going to press down. How does that feel?
Yeah, there's pain there.
Pain, for sure. So it is very tender to touch, especially compared to your left breast, which you can see there's no infection in there. So this is all I have to do for my physical assessment. I'm just going to let you put your gown back on. Perfect. So for everything you're describing from my physical assessment that I just did, I believe you may have mastitis. So mastitis is an infection or inflammation of your breast. It's known to be tender, hot, swollen, it's wedge-shaped. It's primarily in the upper region, just because that's where most of your breast tissue is. So mastitis actually also shows the same symptoms as the flu and the cold, with muscle aches, chills. So it really does align with everything you're feeling right now.
Really? Is it bad? I'm just confused. Did I pass it on to Odette? That's why I skipped this morning's feed, because I don't want her to get hurt. You know what I mean?
No, for sure. So mastitis is actually most common during the first 3 to 6 months of breastfeeding. So by having it now, it's actually very normal. As for skipping breastfeeding, we actually don't recommend that. And we ask you to continue breastfeeding, as the nursing will not harm Odette at all, and actually helps clear up the inflammation and infection present in your breast naturally. As to why you have it, have you had any other children breastfeed in the past or any extra stress lately?
Yeah, I never would have thought. I just assumed if I was infected, I'd pass it on to her.
For sure.
As for breastfeeding, I did breastfeed my 3-year-old for a year. In stress,
Okay.
I've been under a lot of stress because I brought him to daycare, and he's just been screaming because he's confused with COVID and all these masks and gowns.
Yeah,
He's
for
just
sure.
scared.
Well, I'm really sorry to hear about your son. In regards to skipping Odette's feed, that's what most people think. So again, just continue to feed. That's a natural way to clear up the infection and get the milks out. As for stress and why you could have developed mastitis, there are actually many other risk factors. So there's engorgement of the breast, cracked nipples, clogged ducts, a tight or constricted bra, poor sleeping position, putting a lot of pressure just on that one area. But the major risk factor, that is most common to have mastitis is stress and fatigue, which is very common among breastfeeding mothers. So I'm just going to go consult with the lactation consultant and the doctor, and I'm going to be right back, okay?
Okay.
Hi, April. So after talking to the doctor and lactation consultant, we are confirming that it's mastitis. So it matches up with all the symptoms you're feeling, as well as the physical assessment I did. And we think the added stress you have with your son getting dropped off at daycare with COVID, that could be one of the main reasons.
Yeah, I've been tired and definitely stressed lately. So what should I do?
Sure. So as I said earlier, continue to breastfeed. Other things you can do is apply moist heat, ensure you're drinking lots to keep you hydrated, try to have someone come in to support you, to take time for yourself to de-stress and relax. If you continue to have pain, you can still take Tylenol and Advil on the side with the antibiotic. So we are going to be sending you home with 875 milligrams of amoxicillin clavulate. It's an antibiotic. You're going to take it twice a day until it's completed. And it's safe to take while breastfeeding. It's causing no harm at all to Odette.
That's good, but I must say I'm not looking forward to this. I'm just a little overwhelmed.
No, for sure, and that's so common among breastfeeding mothers. So you're not alone. We want you to know that if your pain doesn't subside within 48 hours, give us a call and we're going to reassess you, have you come back in. We'll take a sample of your breast milk and send it to the lab as well. And a few extra tips: if you're saying it feels too sore to breastfeed from your right breast, try placing maybe a warm cloth over your affected area for 15 minutes before feeding. Try massaging your breast, try and get that milk flow down to your breast. Or second last thing, you can try feeding from your left breast first before switching to your right, or if it's too sore, just hand express your milk just to empty out that milk supply for sure. So I think that's everything from me. I gave you the antibiotic prescription. Is there anything else I can help you with today?
No, I think that's it.